Hi, I'm Dr. Yolanda Cintron, and it is my pleasure to interview in my podcast, Dr. Yoli, Dr. Blanche Grube. We have known each other for over 29 years, and I'm so proud of all the accomplishments and everything that Dr. Blanche has accomplished. She just put a book out there, and I cannot wait for you guys to read it. Please welcome Dr. Grube.
We say, oh yeah, if you're healthy, you're either healthy or you're sick, one or the other. No, 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 that's not true. You can be healthy, come in contact with something in your environment or with the people around you or food that you ate or a toxin and be temporarily sick, but then you recover. That whole scenario from getting sick to recovering, that's the sign of health. Our bodies are supposed to do that. I learned what true health is and how much it takes to truly be healthy. And so that was really a turning point for myself and for my husband to really understand that not only is it healthy is being able to withstand the changes in your environment to a certain point. There are some things in our world that no matter how good you eat, no matter how well you take care of your body, if you have mercury, which is a highly toxic element, it is the most toxic element on the face of the planet Earth, second only to plutonium, which actually is man-made. The only way you get plutonium is man-made. It's not natural. Mercury is natural. It is in the earth, but it's highly, highly toxic. You get enough
Yes.
mercury put in your mouth, you will die from it. Now, you may not die the day after you left the dental office, but you certainly will shorten your life with too much mercury. And then there's all kinds of other things like arsenic. And nowadays we're talking about plastics that are
Right.
being absorbed into our bodies from the way we cover our food. I started as a dental assistant at the age of 19. And I was
So,
in dental at the age of 19. So, to see,
you were exposed to mercury. Now, the American Dental Association, they have a list of things that they agree that mercury cause and are linked to anxiety and neurological things. Now, dementia.
yes.
Dementia is like a big topic. You want to talk about it? Because I have a lot of patients coming with cognitive decline, anxiety, depression. And I have seen literally a change and a shift of their symptoms once you get the toxic loads out of the mouth, the mercury, the infection, the cavitations. So what has been your experience with patients like that?
And dementia is a tough one because mercury has an affinity to fat in the body. And what's the number one organ that has the most fat? The brain and the nervous system.
Yeah.
Okay. So you have all of the mercury being absorbed into the brain, a lot of it, and it's very difficult to get it out of the brain to cross the blood-brain barrier. And so it accumulates over the years. By the time you begin to get the symptoms of dementia, it's already a little bit too late. It's very, very, you have to do drastic measures. So, let me say less than average person, who doesn't have any extra money saved up, they're living from week to week. You
Yeah.
tell them that with dementia, they must do things radically different. They must do what we call the full dental revision. Not just take out the mercury in their mouth, but take out the mercury in their mouth, remove the tattoos. No, don't say that. Nobody
Yeah.
wants to hear that. Yes, remove the tattoos because they all
Yeah.
have mercury in them. You
Yeah.
have to remove the fillings, you have to remove the tattoos, you have to remove the root canals that have
Yeah.
mercury filling inside the root canals. You have to remove the crowns that are covering mercury fillings. So it's a huge commitment.
Yeah.
It's successful, yes, very successful most of the time. So you do the full dental revision the right way, which, as you know, I believe it's the Huggins-Grube protocol. We have a very specific way of removing the stuff from the mouth so that the patient doesn't get any sicker, because that's very, very important. All kinds of precautions are taken. When Dr. Huggins was teaching the protocol, we were doing more precautions and doing more things than IAOMT, IABDM, all the organizations
Right.
that have lots of letters after their name. and they teach dentists how to take it out safely. Well, we were doing that way before, and today, to this day, we're still doing it better than they do it.
Yeah,
Okay.
absolutely.
So
Because
yeah,
it's so much more than putting a rubber dam, you know.
absolutely. There's
And the
so
thing
much more
is,
to it.
there's
There's
so
so
much
much
more
more.
to it, you know. A
There
lot of
used to
people a lot of people are trying to join and become biological dentists lately, which is a great thing, you know, that
good,
there's a
good,
movement away from the traditional dentistry. And there's a lot of opposition, you know, and in margination and ridiculing of dentists that are, you know, pretty much saving lives.
right.
So there is, you know, we have been around for a long time doing this.
Mhm.
So it is very humbling, you know, when we started, what don't you know? You didn't know. And then
Right,
as you become an expert and you do more and more and you get feedback from the patients and you see who gets healed, how did, you know, the whole process, it's more than the removal of the toxins in the mouth. Is so what are we going to do after?
right.
What is
So
the
the first
detox
step,
protocol?
that's just the first step, is
Yeah.
doing the full dental revision, getting everything out of the mouth that's not supposed to be there. Okay, now what? Well, now we have the rest of the body to deal with. And when it
Mm-hmm.
comes to dementia, we have the brain to deal with. Now, I don't
Mm-hmm.
know about you, Dr. Cintrone. I know you're very well educated, but a lot of dentists do not know that so far there's only one substance, one, that crosses the blood brain barrier and pulls mercury out of it. All the other detox, and there are many detox elements out there, many of them. There's DMPS, the DMSO. It's just amazing. Only what we used to call OSR, oxidative stress relief, was the only material that crossed the blood-brain barrier. Well,
Mm-hmm.
it was such a successful material that
Uh-huh.
that that there was a group of mothers who had autistic children, and after a short time of taking OSR, their children started to speak. They had not spoken for years. Their children
Mm-hmm.
started to speak. They could speak full sentences. They started reading. Their whole behavior changed. And these mothers went crazy, telling everybody about it on the internet.
Yeah.
No, so what did the FDA do? They shut it you
Yeah.
bet. They said,
Yeah.
"No, no, 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 we can't have something on the market that actually makes people healthy." Yep, there it is. I said it, healthy. You can't have something that's gonna make people healthy, and if this is a chemical that cures autism, well, then it's a drug, and if it's a drug, Dr. Boyd Haley, who was the
Mhm,
inventor of it, was gonna have to do all kinds of double-blind, university-based
mhm,
studies with 20,000 people that would have cost him millions and millions of dollars. And so he was forced to take OSR off
mm,
the market.
mm,
Here's the good news. The good news is it's back on the market, but not as OSR. It is now back on the market as
mhm,
water purifier. Oh, that is what it does. It does purify water. You can put it in your fish tank, you can put it in your backyard swimming pool, and it'll clean up
mhm,
all the heavy metals in your pool. You
mhm,
can also put it in your body because it doesn't have any side effects whatsoever. So that's the good news. You can get the water purifier through
mhm,
Dr. David Kennedy in California. Here's the
mhm,
bad news. Because he suffered so much with the FDA chasing after him and taking him to court, that he now has to charge $800 for one bottle
mhm,
of OSR that will last you 1 month. Now, if you have Parkinson's, if you have uh, early dementia, if you have
mhm,
Alzheimer's, you need more than just one bottle. You're going to need a double dose, at least a double, but maybe even a triple dose. So it's going
mhm,
to cost you $160 a month, maybe more, maybe $240 a month. If you think about it, you do that for a few months and you start to get your cognitive functions back. Is it not worth it?
yeah, of course.
Worth it. I mean, when you think about it that way, how much are you willing to pay to get your brain back? I would
Yeah.
certainly pay for it. That's for sure. I would pay for it. So that's where people have to get that now, because if somebody has dementia, that is the second thing they have to do. The first thing is clean up the mouth. The
Mhm,
second thing is clean up the brain.
mhm,
And of course, the third thing is don't put anything else in your mouth. In other words,
mhm,
don't go out and have a fish dinner, because all of the fish in the United States I'll say it again. All of the fish in the United States, yes. Dr. Blanche, do you mean even Alaskan crab? It was Alaskan salmon
Salmon,
that
yeah,
is caught
wild caught.
wild and shipped overnight in a hermetically sealed plastic bag and frozen? Yes. No, even that fish has
Mhm,
mercury in it. Now, I know salmon is great because it has alpha omega 3s in it and all the
mhm,
fatty acids that we need, but
mhm,
it does have more mercury in it. And if you
mhm.
have a complete dental revision, you get your whole mouth cleaned up and you're taking OSR, your water relief, you're cleaning up your brain, and then you go and eat a fish meal.
It goes back to the brain.
Your body's liable to freak out. We call that a secondary autoimmune response. In
Mhm,
other words, your body has responded once to
mhm,
something that it didn't like. If you introduce it a second time, it's going to respond vehemently. So I
mhm.
highly recommend staying away from all forms of fish. All forms of fish.
Even sardines.
Well, okay. You're getting really picky now. Yes, sardines are the smallest of the fish. Anchovies, they're fishes. They're okay. I wouldn't eat shrimp because even though they're very small fishes,
Mhm.
shrimp, like lobster, like crab, are what we call bottom feeders.
Yeah,
So
yeah.
shrimp and scallops, yeah, okay, they're small fish, but they're also garbage collectors. Why is it that I'm gonna play devil's advocate here? Why is it that the stuff that really tastes delicious is so bad for us? I mean, besides the ice cream and the cake and all of that, even the fishes, the ones that really taste very tender and very
Yeah.
juicy, are really not good for us.
Well, I think that is a matter of the amount of pollution that is being created by us. I know that, say, my grandparents were never ill. They died from old age. My parents, they're 85, 89. They're pretty healthy. I think that, eating from the backyard, eating from your own, space now, the farmers markets are becoming popular, but the amount of pollution in the air and on the earth and the soil on
Right.
the air, all those things are affecting our capacity to digest. Most people have a dysbiosis of the gut. There is a lot of things going on. So, from a dental point of view, we see people that are genetically very strong, but the mouth full of root canals. Like on Friday, we did a lady. She had titanium implants, root canals with aphysis, and a cavitation on tooth number two with mercury in the bone and in
Oh
the
boy.
tissue. So we had to do an excision of the tissue, removal of the mercury from the jawbone, because the main concern is preventing dementia, preventing cognitive decline. And it's interesting because now people are speaking more. You have Dr. Pompa speaking about the mercury toxicity that he suffered.
Right.
And
Right.
he's like on Facebook telling everybody, millions of people a day, how many, autoimmunity, depression, he was paralyzed. He's sharing his story. So he's somebody that is educating people in a way that's very powerful. So I'm grateful for that because it takes a lot of courage. These doctors are saying, hey, I had breast cancer and then I did everything right. And then I didn't know about the oral, and now Dr. Veronique Desanores. I met in an actually Annie Appleseed conference, and she wrote a second revision to her book on how to prevent breast cancer. And the revision is she added a dental chapter.
Right, right. Because if somebody has breast cancer, you tell me what side the breast cancer is on, and I will tell you which tooth is root canaled.
Yeah, we already know. Right?
Years. In
Yeah.
all of the years that I was practicing, I had been challenged by Dr. Huggins probably 30, 40 years prior. He
Mhm.
asked, and this was a class of 60 dentists. He said, if any of you find a woman with breast cancer who does not have a root canal in the bicuspid, second bicuspid, or upper first molar,
Mhm.
that I will give you $1,000.
Mhm.
Then he added, he says, oh, wait a minute, I have to include if they had the tooth extracted, but they have a cavitation.
Mhm.
So if you find a person with cancer who doesn't have a root canal or cavitation, I will give you $1,000. And I thought, "Oh, boy, I could use $1,000." I had that money spent 6 ways till Sunday because I knew I was gonna find that person in 40 years, and I literally had over thousands of women come through my office with
Yeah.
breast cancer. I never found one that did not have either a dead tooth, root canal, or cavitation. Not one. So, if everybody who has, and this was not just breast cancer, even my patients who had other forms of cancer, they all
Hmm.
had either root canal, dead tooth, or cavitation. So if everybody with cancer has a root canal or a cavitation, does that mean that root canals and cavitations cause cancer? You can't make that statement. Now,
Right.
boy, is
But
it suspicious.
your health is your wealth. If you don't have your health, you don't
That's
have
right.
it.
'Cause you don't have anything. That's right. Sacred Medical Order of the Knights of Hope. SMOKH.org if somebody wants to look it up. It is run by a man named Dr. McWilliams. He teaches about diet, he teaches about colonoscopies, colon hydrotherapy, he teaches acupuncture, he
Hmm.
teaches all of this stuff, but his main interest and what he has impressed upon all of us doctors, and not everybody's a doctor. Some people are just nurses. Some people are, I shouldn't say just nurses, but some people are nurses. Some people are business people, but they
Right.
have a tremendous interest in health. So they've signed
Mhm.
up and they've taken a lot of the courses. So what he has really emphasized more than anything is the new idea, which is an old idea, a very old idea, but it's now becoming public, is that cancer is actually a parasitic infection.
Right.
And so now that we know that, now, yeah, the root canal tooth is simply the house where the parasites live.
Right.
The root canal tooth and the cavitation is simply the house that produces the toxins and the low
Hmm.
pH that allow the parasites to continue to thrive and to grow. And so now, knowing that, we have a whole different attitude about treating cancer. Yes, you still have to do the full dental revision. Yes,
Hmm.
you still have to extract the root canals. But now, after all of that and doing the detox, you also have to do the anti-parasitics. And it's
Hmm.
amazing how many people with stage 4 cancer, all kinds of cancer, stage
Hmm.
4, are
Yep.
being completely healed in months, in like 2 months, doing a series of ivermectin, fenbendazole, menbendazole, all of the anti-parasitics. And so he has taught us how to take a drop of blood from somebody's finger, look under the microscope, and see the condition of their blood, because the condition of their blood tells you how many parasites they have living on.
Hmm.
So again, we continue to find the cause of a disease, and then we go, oh, but what caused that? And so we go back another step, and then we say, well, what caused that? And we go back another step. And so here again, we've gotten to the point like, yeah, now we know root canals and toxic materials cause cancer, but how do they cause cancer? They cause cancer by creating environments that the parasites love.
Right. So wouldn't you say would be fair as a preventive measure for people to do the antiparasitics? Or they should definitely do the removal of the toxins first?
Yeah, well, what's the sense of taking an anti-parasitic if you still have that's like trying if you still have a root canal, that's like trying to fill the bucket and you have a hole in the bottom of the bucket.
Right.
You're never ever going to fill that bucket completely. Never. Right?
Yes.
So why take antiparasitics if you have something in your mouth that's a machine allowing the growth of more parasites? That doesn't make sense.
Exactly.
Yeah, yeah, it's a good. I mean, everybody should be on antiparasitics, but everybody should also have their root canals extracted. Absolutely.
Yeah.
That's
Yeah,
a
we had a lady that came and she had 8 root canals, and the DNA biopsy was showing very advanced infection. The teeth and the jawbone and everything was so,
right.
so infected with, all kinds of parasites and Klebsiella pneumonia, Bacterium, and all that. So
And
it's
she
a
lived.
miracle. A miracle she's still alive.
She's still alive.
Yeah.
Well, she did. She had all the extractions.
Yeah.
Well, see, that's sometimes that's the price you have to pay if you want
Yeah.
to live longer.
Yeah.
I think there's two kinds of dentistry in this country, and there's some dentists that I know like to ride the fence and do both kinds. It's not easy. You could do both kinds. There's the dentistry that's all about health, how to clean up the mouth and how to put fillings in the mouth that are not going to be an attack on your immune system. That's what I call biological dentistry. And then the other kind of dentistry is all about looking good, feeling, and looking beautiful. And those are the people who are, like, will crown all their teeth, or veneer all their teeth, have implants put in everywhere. And while that does make you look beautiful, it's not always the best thing when it comes to your health.
Mhm.
So the only way I would ever recommend for somebody to do the beauty part of it is if they really are already healthy. If they're
Right.
already healthy, they don't have any kind of diseases, they've never had cancer, then they
Hmm.
might want to consider having an implant put in. They might want to consider veneering their front teeth. But I don't recommend it for everybody across the board because most people are not that healthy.
Right.
Most people, if you take a look at their history and what their diet's been like and what
Hmm.
they've been smoking for the last 40 years, they're not that healthy. And to do
Hmm.
excessive dentistry on them is really going to be pushing them over the waterfall.
Yeah. So a lot of people already come with the crowns. They're already coming with the veneers. So it's like that's how they are coming. So you cannot pull all the teeth out. Only the ones that are like, ultimately unsalvageable. They have root canals and cavitations and things like that.
Right, that's a different story. Then they
Yeah.
have to come out. But even the crowns, I mean, if they can afford to have a metal crown replaced, they
Hmm.
should. Yeah,
Oh, absolutely.
get the metal taken out. Because 95% of these metal crowns, when we cut them off, they have amalgam underneath them anyway.
They
And
have
if that
amalgam, they have
yeah,
aluminum, they have lead.
they have pins. They look like little antennae.
Yeah.
They have pins and they could pick up radio stations with them. And
Yeah,
it's amazing.
absolutely.
You take those out of a person's
Hmm.
head and they think so much more clearly. They feel the difference immediately.
The
And I
next
said,
thing.
"Well, yeah, I just removed the antenna that you had stuck in your tooth. That's all."
The next thing. So tell me about your most impactful case that you treated somebody with chronic fatigue syndrome. Everybody's coming right now. They're exhausted. They're unplugged. I'm talking about people in their 20s.
Right. Well, I would say probably the very first woman who came to me with a mouthful of amalgams and brought me my first article to read about mercury. She had, I mean, every tooth in the back had mercury fillings in them. And when I found out about mercury, I made her my poster child and I removed all of her fillings, every single one. She
Mm,
never had root canals, but I removed all of her fillings. She had such chronic fatigue that she could either go food shopping and buy a few items, or she could do a load of laundry, but she
mhm.
certainly couldn't do both.
Wow.
That's how much her fatigue was. And a
That's
year a year after her full dental revision, she was on the top of Black Diamond ski slope, and suddenly it came to her. She said, "Oh my gosh, it's been a year. I could never have done this a year ago." She was
that's
actually
amazing.
skiing down the hill with her kids.
That's so beautiful.
Yeah, absolutely amazing. And I've got a whole book full of stories like that. This is a copy of my book. It's called Chew on
Yes.
This, but
Yes.
Don't Swallow, meaning,
Yes.
chew on what the dentist tells you you need, chew on it, think about it, but that doesn't mean you have to swallow. You don't have to do everything that the dentist tells you to do. You should
Yes.
research it, look it up. And so I've got tons of stories in here. Literally almost about half of this book is all research for the scientifically minded physicians who say, "Oh,
Yeah.
there's no proof." I've got
Mhm.
plenty of proof in this book.
So tell me about anxiety and the impact of mercury on anxiety, depression, and all the cognitive things that we know that is so abundant in our culture and is
Right.
affecting the young people. Everything has mercury. The parents had mercury. So that has an impact on the children.
Right. Well, there are actually two ways that mercury hurts the body. Yes, the element mercury itself is toxic and enters into the bloodstream, enters into the cell, and keeps the cell from functioning properly. That's a mercury issue. But there's also the electrical issue because every amalgam filling is made up actually of five different metals. So, therefore, you have five different metals in a saliva solution, which is a salt solution. That's what our bodies are. We're part salt. You have 5 different metals in a salt solution. Therefore, by definition, every single filling in your mouth is a little battery. And that little battery has an effect on your brain. So we have people in the early days of removing amalgam. It was very, very important that the person had somebody with them. They had to have a caregiver to be with them during the procedure and a caregiver that was going to stay with them for 24 hours afterwards. Why was that? Well, because we knew that when we removed the filling with the highest negative charge, we were drastically changing the function of the brain. And so people who had anxiety, who had nervousness, who had horrible thoughts, suicidal tendencies, when we removed the filling with the highest negative charge, their brain thinking changed. And it was very important to have somebody with them just in case some of those suicidal thoughts came back to them. And it was just amazing how dentists today, most of the dentists today take out fillings and they have no idea what the electrical charge is on each and every tooth. And
Mm-hmm.
so sometimes they wind up accidentally taking out a filling with a lower electrical charge. Well, if they do that, they're going to increase the effect of the filling with the higher electrical charge. Picture a classroom that is a kindergarten classroom with one really bad boy, and he's creating a riot in the classroom. Well, in order to make that classroom better, what you've got to do is remove the bad boy.
Mm-hmm.
Get him out of the classroom. If you don't do that, if you take out the sweet little girl who sits in the front row, take her out. You're actually making the situation worse. Now the bad boy has more power and he has more room to create havoc. So it's very important that the filling with the highest negative charge come out first. So how does a dentist know which is that? He or she has to measure each tooth during the examination period and find out which ones have the highest negative charge. And then it's very important that those are the fillings that come out first. In the old days, Dr. Huggins, we used to take out just one section at a time. We didn't have conscious sedation back then. We used to take out one filling first, the filling with the highest charge, and then we take out the rest of the fillings in that section. And people would come back to us the next day and say, "Oh my God, I thought of something I hadn't thought of in 30 years. It's just all
Mm-hmm.
these thoughts started coming back to me that I hadn't thought." Well, yeah, those thoughts got locked into their brain when
Mm-hmm.
that filling was put in.
Mm-hmm.
Unfortunately, sometimes those thoughts were bad thoughts. They were either being molested by somebody or they got into an argument and a fight with somebody, and the filling was put in the mouth. That thought got locked into that part of the brain. And here we come 25 years later, we take the filling out and the thought gets released from the brain. We saw it
Mm-hmm.
all the time. It was amazing. And so if something negative came up for them, we wanted to have a caregiver with them and to just kind of talk them through it and let them know it was going to be okay. They were just
Mm-hmm.
cleaning out not only the bad stuff in their brain, they were cleaning out the negative thoughts in them
Mm-hmm.
also. I mean, it's just amazing when you think about it. Anybody has a mercury filling in their mouth, they are not who they think they are. Think about that.
I understand perfectly.
They are not who they think they are. It's
Yeah.
not until all those fillings come out that the real person
Yeah.
then can function.
Yeah.
That's when the real person can function. So it
Yeah.
really is, you have to have it done the right way. You know, you
I love that you're touching on that because, we have to treat the patients as a whole. Not only, the physical part is the easy part.
right,
The spiritual baseline, their source, what they're getting, grounded, the thoughts that they're
right.
saying, their actions, their heart, what they're feeling and thinking, but that's what makes a human a whole person. It's not just the physical part. The physical part is the easy part for us, if you're an expert. Now, what in the past we used to have this machine, the blue machine, to go on top of the teeth and measure. Is there something newer that has come out or is the same?
We're still using the same route. It's called a reader meter.
Yeah.
Little box, little
Yeah.
black box with two. One probe is the ground that goes inside the patient's mouth. The other
Mm,
one is the pointer. You touch each filling, each tooth, and you find out what the electrical charge is on them. And it not
Mhm.
only tells you what the most negative amalgam filling is, but you can also put it on a tooth that doesn't have an amalgam filling. And if you get a
Mhm.
very high reading, it tells you there's a lot of activity inside that tooth, meaning a lot of inflammation. So it
Right.
kind of helps the dentist to know which one of the teeth are really not that healthy. A tooth should never have a charge of more than 40
Mhm.
well, let's say 40 microamps. Never have more than that. And if it does have more than that, there might be something going on with that tooth, and it requires further investigation. Yeah, but
Yeah.
yeah, we're still using the same machine.
Yeah. So many toys that we have, right?
Yeah,
We have so many toys that we use and so much to learn, like some people get overwhelmed when they are starting to learn about biological dentistry.
right.
It's just like
There's a
it
lot to
is
it
it
because
is
you're
a
you're
lot. Yeah.
learning you're learning everything that they did not teach you in dental school. In dental school, they taught us anatomy, physiology, chemistry, and how to fix teeth. Basically, the four things that we learned in dental school. They really did not teach us anything about the energy fields of the body and the meridians.
Right.
They didn't teach us anything about how can you relieve somebody's pain naturally
Mm,
without giving them drugs that they could become addicted to. I mean,
right.
even before I was a biological dentist, I didn't like giving people,
Hmm.
oxycodone or,
Hmm.
Tylenol number 3, Vicodin, all that stuff that we used to give people. Some dentists just gave it to them automatically because they didn't want them
Right.
calling up late at night. But, all of those drugs have some potential for being habit forming. But
Yeah.
they
Not only
they didn't
that,
teach us in
they
dental school
they cause
what else to do.
constipation.
Yeah, that's the least of it. But, they didn't teach us acupuncture. They
Yes.
didn't teach us about herbs. They didn't
Yeah.
teach us about homeopathy. So all
Hmm.
of those subjects are now what we call holistic or biological dentistry. And so there's some dentists that consider themselves a biological dentist and they only know how to remove amalgams the right way. And then you have dentists who do homeopathy, do acupuncture, do herbology. They add all these different modalities to help
Hmm.
the patient get better in a holistic way so
Yeah.
that they're not adding more toxins to their body. To me, that's what I always believed biological dentistry was. It has changed over the years. I see fewer and fewer dentists wanting to learn the Huggins Grube protocol. And so I've decided to kind of join forces with Dr. McWilliams and we've given it a new name. I now call myself a monasticist. I'm a monasticist and I practice monastic dentistry. This is
Love it.
monastic dentistry means you provide for the patient what is absolutely necessary.
Mhm.
No more, no less. And it's done as holistically as possible. No more, no less. Yeah. So you need to have all of these different modalities to really be the doctor who
Yeah.
I'm in trouble. I need a doctor. That's the
Mhm.
kind of doctor you want, a monastic dentist.
Yeah.
Not the, you know what? I'm not so sure I like my smile. I think I'm going to find somebody who's really exceptional in aesthetics. Now, I
Yeah.
know for a fact that you are also exceptional in aesthetics. So, yeah,
Mhm.
they could have that conversation with you. But that's totally different
Yeah.
than my face is swelling up. I need a dentist right away.
Right.
That's
Yeah.
two different kinds of doctors. And like I said, Yolanda, you are one in a million because you do both ends of it. You
Yeah.
you not only do
Well,
the aesthetics, but you do the biological part also. And there are
I
very
think,
few dentists who can do that, who can
yeah.
cross over.
What happens is that, originally, right, my vision when I was very young was I knew how my smile affected my confidence. So
Mhm.
that's where I went into dentistry, trying to give people confidence about their smile because I did not have that. And then when I got into it, I realized how barbaric people were. And then I said, okay, I'm going to learn how to be a spa dentist. Listen to the patient, listen to their worries, what their concerns, and then see how can I have a really nice environment and what things are out there for me to use as a tool. So I
Okay.
learned about, new NLP. I learned about Nucom. All kinds of different things that
Wow.
would help me be able to have a patient in a state of mind that they would be able to receive treatment and not feel violated,
Yeah, and traumatized. That's right.
traumatized. So for me, that's very important. And I'm very in tune with the patient's spirit. where are they? Believe it or not, the first thing that I do before I treat a patient, I pray, and I pray a scripture that it says, be anxious for nothing, and in
Right.
everything, in prayer and supplication, let your petition known to the Lord. And the promise is that the peace of the Lord would be in their mind and their heart. And the moment I finish that prayer, which every single time, the blood pressure drops.
Wow, that's fantastic.
So, it's like, because you're in tune with the patient, you're in tune with God, you're in tune of what is out there. Like you said, acupuncture, herbs, knowing the meridians, knowing all the medical history. You have to kind of investigate and create a treatment plan for each patient that's going to be different.
That's right. That's right.
Because
So you are also a monasticist. You're a monasticist already.
Well, it's because, you care and you
Right.
want the person to have a good experience. And, it's not just what you do, it's what you do after.
That's right.
The post-op, making sure that they are ready for the surgeries, that they have their foods and their soups and their herbs and everything ready, because you
Right.
don't want to send a person in a little boat into the river and they don't know what to do. So it's more than that.
Right.
So I love what you were saying about the blood and the microscope. I have doctors that are practicing and they're doing the blood work,
Hmm.
for the patients, and they see the metals in the blood. They
Yeah,
see
you can
the
see the metals in the.
parasite. That should be standard of care, don't you think?
I think it should be standard of care for all dentists. That's right.
Yeah,
Every dentist should have a microscope. Every single one. I mean, because there's so much that what they say is the health of the mouth determines the health of the body. So
yeah,
when you look in somebody's mouth, you not only look with your eyes, but
mhm,
don't we also take x-rays to look
yeah.
in between and look inside the teeth, see things that we cannot see with the naked eye? But then also we can take samples of the saliva and the plaque, take samples of the scrapings on their tongue and put it under the microscope, and we see a sea of
It
microorganisms and
is, yeah,
things that people would never imagine. They say, is that in my mouth? I said, well, you saw me take it out of your mouth.
yeah,
You saw me put it on the glass slide. Where else do you think these little creatures came from? And they're blown away.
yeah.
And then you take it one step further and you prick their finger and show them that those parasites, those very same parasites that we have dentists have been screaming, you got to floss, you got to brush, you got to floss, you got to brush. You
Hmm.
can prick their finger, look under the microscope and say, you can't tell me you're flossing and brushing
Yeah,
because those little parasites have now entered into your whole bloodstream.
yeah,
And
yeah,
where are they heading? They're heading to your heart
yeah.
because that has the most blood in it. It's very fleshy. They're heading
Hmm.
towards your liver, 'cause it also
Hmm.
has tremendous amount of blood and it's very fleshy. And then they're heading up towards your brain because they can hide there very well. And so this is where all your parasites are. And so usually at that point, when they already have parasites in the blood and you can see it under the microscope, flossing is not going to get rid of that.
Hmm.
Is not. That's when, as a good doctor, as a good monasticist, you would put them on anti-parasitics. They have to go on anti-parasitics for a short period of time. And then you check the blood again to see, are you getting any better? And if they're not getting better, you ask them, are you eating sushi? Are you eating pork? Are you eating lots of sugar? High fructose corn syrup? Are
Yeah,
you eating all of the things that feed these parasites?
yeah.
And of course, you gotta confess.
People are amazed. We used to have a microscope, and it was too much reality. So what we're doing is, yeah, they couldn't handle it. What we're doing is biofeedback. So,
They're more
this one, it
legitimate,
says
right.
parasites, bacteria. This one tells you what's the name of the parasite.
Wow.
So it's like, okay. And then, it's like that's how we work with the patients, because the microscope it was freaking them out because
It's it
there's parakeets.
yeah, but, it's the truth. I
It's
like
weird.
freaking them out. I like them seeing the truth. We have a passion for what we do, and our passion is to help people get better.
And we
And
keep
and
learning. There's so much
yeah,
to learn. What else
there's
don't I
so much
know?
'cause if my hands and my eyes are not doing the Lord's work, then what good is my life?
Right.
You know,
Right.
we're
I
we're
just
both
admire you because you are so courageous, Blanche. You're one of the most courageous biological dentists that I know. You are such a great communicator and you just know the science behind it, the biology, the chemistry, the protocols. We should clone you.
I wish we could.
We should clone you.
I
You're a
wish we
wealth of
could.
information. And I'm so happy and grateful that you wrote your book because, you know, I was waiting for years for that book.
It's interesting. My lawyer had a talk with some of the board members, and they were complaining about all of the things I had written in this book. And when he told me about it, I said, "Oh, good. That means they read my book." He said,
That's,
"Yeah, they weren't happy about it." And I said,
that's
"Oh,
right.
they're going to love my next book. It's called Implants. You want to stick what? Where?" That's my next book.
That's awesome. So
That's right.
it's a humbling experience to be a dentist. It is. Before we close, I wanted you to tell me if you had a message to share with the world. We know that the European Union banned mercury in 28 countries in January of this year, 2025.
That's right.
Thank God for that. They love their
Yeah.
countries. They love the people in their countries, and they're moving in that correct direction. We're praying for America, in Puerto Rico, that, mercury would be outlawed so people would not be poisoned with the mercury. What would you, want to share with millions of people?
Lord, that's a tough one. I would want to say to millions of people, if I had the full audience of the whole world, if I had the full audience of the whole world, I would say, please give second thought before you put something in your mouth.
Yes.
Because you truly are what you eat. You need to give second thought to before you put something in your mouth. And that's where health and life begins and what kind of choices you make as far as what you eat. So that's really number one. And number two, don't think just because the doctor said you need something means you need it. Always get a second opinion, even a third or fourth opinion if you have
Mhm.
to. Because once you make a decision to do something with your teeth, very often it cannot be reversed.
Mhm.
So make sure that you make a wise decision. And the only way you can make wise decisions is if you pray and you ask for wisdom. It doesn't
Mhm.
just come to people naturally. Our nature is to not be wise. Our nature is to be stupid actually and to do
Mhm.
things that are a lot of fun and feel good. That's
Mhm.
our nature. So
Yeah.
in order to be wise and make the right decisions, even decisions that might be painful, you have to pray for wisdom. And like I've always said, you have to be in constant communication with your creator. Otherwise, nothing is of value. Absolutely nothing. And so those are really the first three things that I would say.
Mhm.
Watch what you eat. Take care of your body as best as you possibly can.
Mhm.
Don't do everything that the dentist says you have to do just because the dentist says you have to do it or the medical doctor, especially the medical doctor, especially if you have cancer and they say, oh, we're going to do chemo, radiation, and slice and dice. Run like a bunny, really. Run like a bunny and get some
Mhm.
other opinions.
Yeah,
Be
but
brave.
a lot of doctors use fear. A
Right.
person has cancer for 10, 15 years before they get diagnosed.
That's
And then
right.
suddenly there's a fire, it has to be done immediately. They have to do this next week. And I'm like, please, let's clean up your mouth before we do that. It'll give you a better chance.
Yeah, nobody gets cancer in 2.5 days. You get cancer over years and years and years. We got over 3 trillion cells in our body. We have more than 3 trillion cells of bacteria in our bodies. We have more bacteria than we have cells. And so
Mhm.
there's this constant back and forth, a constant working together with the bacteria. Sometimes they work against us. It
Mhm.
it doesn't happen overnight. No, it's a long process. So even the prayer and the changing of your mind, it takes time. Doesn't
Mhm.
happen overnight. So those are the things that I would tell people. And of course, I would say, get my book and read it because it's like a little mini Bible of biological dentistry, what you should do and what you should not do. And then
Right.
and then make an intelligent decision. Really. And
Absolutely.
love your dentist, not because they were nice to you, but because dentistry is so damn hard. It's
Mhm.
difficult for the dentist. They all lose a few years of their life doing
Mhm.
tedious work. It's tedious work. It's backbreaking work. Most dentists die 20 years before they were supposed to die because it's so
Mhm.
toxic. And so,
Mhm.
please appreciate that with them. You don't have to agree with everything they say, but appreciate who they are and what they do for you.
Yeah.
Yeah.
you so much. I love it. I
Yeah.
agree with you. You know, it's truly a profession that requires eye, brain, hand, feet coordination. You
Right.
feel like you're, you know, doing this in the circus,
Right.
but
Yeah, right.
it is that part, the physical part.
As always, an absolute pleasure talking with you.
Thank you so much, Blanche. I love you. I
God
thank you
bless you.
so
I hope you.
much. I pray that 2026 is going to be opening doors for you
I sure hope so.
because this is the time. This is the information time.